My name is Jacob Apibila Yimbila. I'm a lecturer at Accra Technical University in Ghana, and I'm also a PhD candidate in chemical pathology at the Kwame Nkrumah University of Science and Technology. My research interest is in colorectal cancer, and my aim is to be able to identify novel mutations that are in colon cancer patients that might be peculiar to Ghanaians and, for that matter, Africans, and may be different from European populations. So this evening we have converged here as the PAPERI Bright Minds Series, organized by the Pan-African PGS Education and Research Unit. And on behalf of our founder and chair, Dr. Wafa Rashid, and the entire PAPERI team, we are delighted to have with us to celebrate the International Women's Day and to honor an outstanding woman leader in genetics and genomics. This special series is dedicated to recognizing excellence, leadership, impact, and to inspire the next generation of scientists across Africa and beyond. So we are excited to have Dr. Burcu Darst. He is an associate professor at the Fred Hutchinson Cancer Center. Dr. Darst's research is focused on identifying and understanding genetic and multi-omics risk factors of prostate cancer in diverse populations. Her research focuses on understanding genetic epidemiology and metabolomic epidemiology of prostate cancer development and progress, along with other complex traits in multi-ancestry populations. This research leverages whole genome, whole-exome, whole genome and whole-exome sequencing data, genome-wide association studies, polygenic risk scores, and metabolomics to understand this etiology and factors contributing to health and disease management practices for prostate cancer across patient population. Dr. Darst has received multiple awards for her work, including Prostate Cancer Foundation Young Investigator Award, the AACR Next Gen Star Award, and an early career NIH NCI K19 ROO fund. We are truly honored to have her with us today, and I am particularly excited to have Dr. Darst because reading her profile, we have so many things in common. I am looking at colon cancer. She is interested in prostate cancer. I'm also interested in metabolomics, and I'm doing whole-exome sequencing, and she's doing the same thing. So I think this is the right person that I'm meeting this evening, and I'm most excited to meet you, Dr. Darst. Thank you very much for honoring our invitation to the PAPERI series this evening. We are most grateful.
Yeah, thank you so much for that really kind introduction. I'm very excited to get to meet you too.
Okay, so we are going to begin by trying to understand the beginnings and how you've been able to move through your career path to today. So could you kindly share with us your journey into epidemiology and what drew you towards this field?
Yeah, so it took me a long time to figure out what I was really passionate about and what kind of career would work well for me. I did a lot of exploration across many things that were totally irrelevant to what I ended up doing today. But while I was doing that, I was working at the Scripps Translational Science Institute in San Diego after I finished my undergraduate studies as a research data specialist. And I had really great opportunities there to be involved in research that felt really impactful and also felt kind of translatable. Like I could kind of understand and see how research could really impact people. And I also got my first exposure to working with genetic data and genetic epidemiology. And as I was kind of thinking about like, how does what I'm doing right now fit into what I might want to do in the future? I was doing some searching on Google and I came across epidemiology, which was described as kind of investigators of causes of disease, kind of like a Sherlock Holmes type of way, and I just thought that was so cool to have a job where you're really trying to solve these problems. using data that we have available to us nowadays. And once I started learning more about genetic epidemiology, how you can use genetics to try to understand the cause of diseases, I just really was hooked and loved it a lot. And that was kind of how I got into this field, um and it just really stuck with me.
Okay, so that is very interesting and very inspiring because most of us early career researchers, we struggle. In fact, as I sit here today, I really struggle to decide that this is where I want to be. This is what I want to do. It's so difficult. So I think it's very, very inspiring to understand that. I mean, you are not the first person to struggle to try to navigate how to find your way or to find your foot in the field. So how were you able to transition from your PhD training in cognitive science to epidemiology and now doing if you like, prostate cancer related kind of research? How did that transition come about?
Yeah, so my undergraduate studies were in cognitive science, and I think that really gave me some good exposure just to the scientific process of how research works, and how research is conducted. But I didn't really get much exposure to genetics until after my undergraduate studies. And that's when I really kind of started getting very excited about genetic epidemiology. And initially, when I started graduate school, after it really was it was really a challenge for me to figure out what I wanted to do. I debated so many different career options before deciding to pursue a PhD. But when I started my PhD, I was actually studying Alzheimer's disease, genetic epidemiology of Alzheimer's, which fit really well with my background in cognitive science and was a nice way to kind of mesh that together because I really loved learning about the brain also. That was what drew me to cognitive science as an undergrad. Um, and then but being able to incorporate genetic epidemiology into that interest was really nice. And then after I finished my PhD, I really wanted to expand my skills and kind of push myself and challenge myself to do something different and make sure that I would be really learning a lot more. Which is how I got into genetic epidemiology or cancer genetic epidemiology because I didn't hadn't done anything with cancer, but to me, cancer felt a little bit intimidating to study because from the genetics perspective, you have two genomes. You have the germline and the somatic genome. And it was really hard for me to envision how I would use both of those data sets to understand genetic risk of prostate cancer, or any cancer. But it was, and I felt like there was a lot of really good genetic epi expertise in cancer and in prostate cancer in particular. So it was a great way for me to push myself and get out of my comfort zone to do something that I hadn't done before and really learn new skills.
Okay, okay, that's very great. So, what have been your experience about mentors and mentorship, and whether or not mentorship played any significant role in shaping your career and where you find yourself today?
Yeah, I think I've been really lucky throughout my my career trajectory to have really good mentors who were so supportive and really champions for me as a person and for my career. I'll mention one of my early mentors that I had while I was working that job after undergrad, but before graduate school when I finally decided I wanted to get a PhD. She like really believed in me. She thought that I should get a PhD well before I thought I should get a PhD. She kind of was always pushing it in a way that your parents push you to go to school. You know, like my mom always said, you have to go to a 4-year school for undergrad, and so that was my goal. But she kind of pushed me in that kind of way. Um, and it took me a lot of exploring different options before I finally kind of realized that she was right, that it would be a good fit for me. But she was just such an advocate and champion for me, and she gave me a lot of opportunities to see research from a different way than I had before. During undergrad, I was involved in research, but I was mostly enrolling participants into studies and kind of walking them through a study protocol where your interactions are really like structured. And I wasn't on the other end of research where you get to analyze data and then publish it and share it and like disseminate those research findings. But working with this mentor that I had after undergrad, I got to kind of see the whole research process through and to see how satisfying it was to have those opportunities. And that's when I really started to like research, even though I had been involved in research for all of my undergrad studies, but I didn't really get to see it from that perspective to really get it. So I really attribute a lot of where I am today to her pushing me and supporting me so much in a really helpful way. And then when I started my graduate studies, I had another great mentor who was just such a champion for me and always kind of had me in mind when opportunities came up. And we just worked really well together, and we're still really good friends today.
Okay, so let's now focus our attention on your current research and your scientific impact. How will you explain the core goals of your research on genetics and multi-omics risk factors for complex diseases?
Yeah, so I'll focus mostly on prostate cancer since that's something that we're both interested in cancer at least. But in terms of prostate cancer, I'm really interested to understand what causes prostate cancer, like what leads to someone developing prostate cancer, with the goal in mind of how could we prevent people from getting prostate cancer and then improve their quality of life, improve their lifespan. So I'm really interested to understand what are the risk factors, including germline genetic risk factors that you may inherit from family members, and then multi-omic factors such as metabolites that might be circulating throughout your body that are maybe suggestive of the development of prostate cancer. Identifying these ways that we can figure out who might be a high risk person to develop prostate cancer that might benefit from screening at an earlier age to be able to catch prostate cancer before it becomes lethal. So
Okay.
that's really kind of the core goal is
Okay.
disease prevention. Yeah.
Oh, okay. Okay. So your work also involves polygenic risk scores in diverse
Mhm.
population. What are the challenges that comes with polygenic risk scores, and what are the opportunities in this field for precision medicine, for drug development, and all that?
Yeah. So prostate cancer is a really unique case for polygenic risk scores because polygenic risk scores work really well at predicting who's at risk of prostate cancer, much more so than most other traits that have polygenic risk scores developed for them. So it's a very strong risk factor to indicate who might develop prostate cancer. One of the challenges in general with polygenic risk scores is that the data used to develop those polygenic risk scores usually is pretty European ancestry centric,
Yeah.
where there's
Yeah.
not that
Yeah.
much diversity or representation of all populations across the world. In prostate cancer, we've really tried to be cognizant of this and to include diverse populations that represent more of a global population. But even so, we do have pretty large numbers of populations from other or participants from other populations included in our studies, but it's still about 80% European ancestry individuals are included in our discovery data sets used to develop those polygenic risk scores. But the numbers are still pretty large, even though it's 80% European ancestry. The numbers for other populations are still pretty large. So the polygenic risk score that we've developed for prostate cancer actually does work really well across all populations that we've tested it in. And the odds ratios are not too different than the AUCs. Like it actually has really good predictive ability in different populations, but it's still not quite as good in, for instance, African ancestry populations as it is in European ancestry. Although it definitely has really good predictive ability, it's just not quite as strong a predictor. So I think there's still some room for improvement in how well that polygenic risk score is doing. And that's something that we've been working on and really being cognizant of that there's room for improvement still.
Okay. But what is your opinion about being able to overcome this underrepresentation, particularly when it comes to Africa,
Yeah.
being overcome the under representation of African genomics
Yeah.
when it comes to genomic research?
Yeah, it's a challenging thing to do. I think some of the challenges are like, there might not be the infrastructure to have these huge biobanks that exist in some continents and some countries, but there are efforts to build up these resources like H3 Africa, and for prostate cancer, there's the MADCAP study, which is a prostate cancer consortium across different African countries, and that has been a really successful and nice example of how we can build up prostate cancer resources across Africa to improve representation, and that's been really successful. But I think there's more efforts like that are definitely needed, because you don't want a whole continent to be kind of left behind or not like benefiting as much as other populations.
Okay. So if our audience may want to find out how does, or if you like, describe how your research contributes to the understanding and reducing the health disparities, particularly in prostate cancer,
Yeah.
what will you say?
So in prostate cancer, we have identified a few variants that are only found in African ancestry populations that are really big risk factors for prostate cancer. And that is really promising, because that means that people who carry those variants may benefit from earlier screening. And some of them are really rare genetic variants, but some of them are pretty common. There's one in the AQ24 region of the genome that has an odds ratio of about 2. And it's higher if you're looking at metastatic prostate cancer. So that, and it's the carrier frequency for that is about 11%, which is really common, especially for having such a big odds ratio. So that means that, like, for the 11% of the population who carry those variants, if they were to screen earlier to catch their prostate cancer at a younger age, you could potentially improve outcomes for a huge number of people. So I think there's a lot of things like that that are really promising to potentially reduce the health disparities that we see in prostate cancer.
Okay. So what is the significance or the importance of multi-omic integration, particularly with genomics and metabolomics?
Yeah. So for any given disease, there are very few instances where a disease is really only driven by genetic risk factors. And so integrating genetic risk factors with other like other systems biology factors and omic factors that might represent environmental risk factors, it just gives us a better opportunity to build a model that's more comprehensive and more representative of all the factors that might be contributing to someone's risk of disease. So, the germline genetics is one piece of your risk, but there are other environmental exposures too that polygenic risk score won't capture. So if we can capture some of those using different omic data sets, we might be able to improve risk predictors beyond what we're able to do with polygenic risk scores right now.
Okay. Thank you very much, Dr. Darst, for this insightful discussion. Let's look at translational research and clinical relevance. In your view, how close are we to applying polygenic risk scores effectively in clinical settings, especially in diverse populations? How close are we?
It's a good question. There are several ongoing clinical trials right now that are implementing polygenic risk scores in clinical settings and returning that information to patients. There's still a lot of them are pretty early, so it's kind of hard to say, kind of what the takeaway is from those clinical trials and should we be using them or not. But at the same time, there are companies that are selling polygenic risk scores directly to patients if they have the means to pay for it. So some people may already be getting this information and using it, but in a way that we probably can't really track and do research to see how helpful it is actually for them. But I think we are pretty close, probably closer than we might be ready for, because, in some settings it's already being used, even though we might not really know yet how useful it is. And in some of the clinical trials, at least that are ongoing, they are making an effort to make sure that that they have diverse patient populations included in their studies, so that hopefully the takeaway from these clinical trials will be applicable across populations more broadly.
Okay. So, in your opinion, what is the role of genetic research in the early detection of these complex diseases and also in precision medicine?
Yeah. So I'll give an example for prostate cancer, but I think this can apply to a lot of other traits too. So for certain, a lot of genetic risk factors that we've seen often have a stronger are more predictive of disease risk in younger individuals, which kind of suggests that, the younger you are, the more likely you are to, if you develop disease at a younger age, the more likely it is to have a genetic component to it. So if someone has a genetic risk factor for prostate cancer, for instance, that could be really informative for what age they should start screening for prostate cancer and potentially the frequency at which they should continue screening. So I think there's really good potential to incorporate genetic information into screening decisions, in particular for prostate cancer, but that might be applicable for other traits too if you wanted to start testing for risk of other disease conditions too.
Okay. So in most cases or instances, one of the challenge that we have is that researchers seem to do research and remain, if you like, with researchers, collaborating with other researchers. And we have clinicians also sitting down in the hospitals, in the consulting room, also consulting with their colleague clinicians. But the integration or the network between that of the clinicians and that of the researchers usually is that relationship is usually very poor. And so whatever we find from research, it becomes very difficult translating it into clinical practice. In your case, how are you able to engage clinicians to be able to advocate, to be able to ensure that the research that you are doing or we are doing, I mean, there's some impact. The clinicians are able to understand what we are doing and be able to apply it in their daily or routine diagnosis of patients.
Yeah, this is something that I am navigating all the time. I'll preface this by saying that being here at Fred Hutch, I do collaborate really closely with clinicians, including urologists and medical oncologists who see prostate cancer patients across the different stages of prostate cancer. But so it's been really amazing to have those close collaborations with them. But even so, like in terms of translating my findings to care, there's this one particular variant that we identified a while ago. It's a rare variant in HOXP13 that's only found in individuals with West African ancestry, and it's a really big risk factor for prostate cancer. And it's a functional variant. It's stop loss, so it definitely has important implications. Um, we recently had reported on it just a few years ago, but there's kind of a precedence for HOXP13. There's another variant in it that's a really big risk factor among Scandinavian descent populations, and that one has been included in guidelines for prostate cancer screening. So I was just wondering, like when we found this, this variant that we identified seems to be a really big risk factor, specifically in West African populations. How can we get this into the guidelines? And I work with a lot of clinicians and I would share this with them, but I still didn't know how to bridge the gap of making this something that should be in guidelines because there's really a precedence for it already with the Scandinavian variant that is in guidelines. So I presented on it many times and I would always kind of bring it to this point. This other variant is in the guidelines and this one isn't. Like, it really should be in there. At some point, somebody put it in the guidelines and I'm not sure how it got in there. Like, I don't know if it has to do with how many times I presented it and said this should be in the guidelines, or if it's that I mentioned it to a specific clinician I work with who, like, there are some that I work with who sit on the NCCN guidelines. But I don't know actually how it got in there. So it's still something I'm navigating. Like, if I have a really good finding that really should be very patient facing and something that's used by clinicians, I'm still not sure how to actually get it. Like, what are the steps that I need to do from discovery to getting them to use it? And I think that's something where it's not only that we need like people who are doing discovery and the clinicians who are implementing things, but we need implementation scientists who can help bridge that gap between discovery and actual translation into use. So that's probably a new kind of area of research that we really need to do more to make sure that we can translate our findings, is working with implementation scientists who can help bridge that gap.
Okay, thank you very much. So implementation science is very, very important, and we need to actually work seriously on it. So let's now look at leadership and mentorship. Usually when it comes to science, particularly genomics and epidemiology, our ladies or the women usually faces a lot of challenges in this kind of domain. As a woman scientist pioneering genomics and epidemiology, what have been some of the challenges or the setbacks in this field for you?
Yeah, that's a great question. I'll mention first that I think I've been really lucky as a woman that I think overall I have probably faced fewer challenges than most other women face. Just to acknowledge that I know there are a lot of challenges people face, and I probably haven't had to experience a lot of those. But in the past, since I started my faculty position here, over 4 years ago, I've had 2 babies. And that has been incredibly challenging to kind of be able to sustain a faculty position and the demands of it, to like be getting grant funding and publishing papers while having 2 really small babies at home, has been incredibly challenging and very demanding beyond any demands I've ever had before. I'm really lucky to have an extremely supportive husband, who makes things possible for me and is just really amazing. But even with that, it's still been hard. So I can only imagine what it's like for other women who might not have that same support structure at home, to have to go through the challenges and also the beauty of having babies. But it's really extremely demanding and has been very hard to be able to be like, in this field, you're kind of expected to be the best you can all the time. And it's hard to do that when you're having to be the best you can in so many different aspects of your life.
Yeah, 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 yeah. So, what has been the impact or the influence of mentorship on your career? And what would be your advice for early career researchers who are watching us or listening to us? What would be your advice to them when it comes to mentorship?
Yeah, as I mentioned, I have been really lucky with mentorship. And a lot of the decisions that I made throughout my career have been extremely influenced by who my mentors would be if I took this new position, or if I decided to attend this school for graduate school. When I decided to attend graduate school, I was debating between 2 institutes, and the reason that I chose the one I ended up going to was really because I there was someone there who I thought would be a good mentor, who I really felt like I connected with. Um, and especially like being a woman, like I'm not saying that we always need to have like a mentor who's of the same sex, but I felt like she would really understand the things I might be going through at that point of my life, in addition to having good connections with good similar research interests. um, and then yeah, beyond that too, like when I was choosing my postdoc, I chose mentors who I thought, a large reason why I chose to do the postdoc I did, was because of the mentors I would have there, and the, making sure that I'm working with people who are kind, and would be able to provide the support that you need at that particular point in your career. And it's also kind of an evolving thing. The support that I needed as a graduate student was really different than what I needed as a postdoc, and different than what I need now. But surrounding yourself with the right people to help you, to be a champion for you and to advocate for you when you need it, is really crucial and career changing.
Great, 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 great. So, we were just talking about women in science. What would be your advice to institutions um, in providing support for women scientists, particularly those involved in genetics and epidemiology? What would be your advice to such
Yeah.
institutions?
Well, I'll mention something that is different in every country,
Yeah.
and that I experienced here in the US. Our maternity leave is like 12 to, I think on average, it's about 12 weeks in the US. And then, after you have a 12-week-old baby, you're expected to go back to your job full time, which is pretty crazy. Like, that is still an infant at home who needs your 100% attention. Somebody has to be giving the baby 100% attention.
Yeah.
Um, I think even at Fred Hutch is an incredibly supportive environment, but we're still kind of within the umbrella of what's the general support like in the US. And I think in general in the US, like that's just kind of normal. Like 12 weeks is a pretty normal time for parental leave. But realistically, like, your body is still recovering, your brain is still recovering. It's hard to function at 100% capacity when you have a baby at home. So that's just, in terms of guidelines for institutes, I would just ways of trying to be more supportive of family, like different family structures and lifestyles is really would be a really helpful thing.
Okay, thank you very much. So let's now focus our attention on ethics, equity, and global science. What are the key ethical considerations when conducting genomic research in global populations? And I think one of the key concerns, particularly when it comes to data sharing and all that, particularly that Africa, we have underrepresentation. If you cannot generate data in your own lab, then it means that you are even cut off in learning. Like some of us who are early career researchers, if you want to even learn, you would have even learned the theories, but how to get the data to even practice becomes a problem because of the issues of ethics. So what are some of the concerns or genetic or the ethical concerns or considerations when it comes to genomic research?
Yeah, I think anytime that there's a site, a global site that's contributing to a research study, if they're collecting samples and sharing back samples where data is going to be generated, that data has to be shared back to that site because it's from their samples. It's really their data, even if they aren't the ones who generated it. So I think, there's no like one gold standard, unfortunately, but I think these are things that need to be kind of fleshed out more because that it should be, that if data is generated from samples collected from a site, the data should belong to that site, even if they don't generate it. I think the MADCAP study that I mentioned earlier, the prostate cancer genetic study, they have a really nice model for how they do this research with their collaborators across different African countries. They actually have, I think there's several sites within Africa where they have sequencing machines or genotyping where they can generate the data that will be used for the study on site. So they help them build the infrastructure to really be able to function more independently and not just to rely on investigators at one site who are doing all of the work and getting all of the credit for it. So I think that's a really nice infrastructure or example where they built that infrastructure.
Okay. Okay. So in designing genomic research, how can we get this done in such a way that it will benefit underrepresented communities rather than exacerbating the disparities?
Yeah. I mean, I think that's a really hard question, especially for genetics, because there's kind of this like underlying requirement that you have to be able to somehow get your own genetic data to be able to benefit from that research, and that's a hard thing on its own. It really depends on the insurance structure of your country and your work, whether that's like getting your genetic information will be something that's actually paid for and covered by your insurance. So I think that's a really, really hard challenge. And even just like, globally, definitely a challenge. And within the US, it's a challenge too, because not everyone has access. Most people don't have access to their genetic data. So it's kind of hard to imagine right now how everyone would benefit from it. But I do feel like we're kind of moving in the direction of one day everyone probably just having their genetic data available in their electronic health records that could help them make decisions about screening decisions and maybe some lifestyle things based on what their genetic data might recommend. But I think we're probably really far from that being a reality. And as we work towards that, something that we really have to think about, how will we make sure that everyone will benefit from genetic findings that we have? And that's a big challenge, I think.
Okay. So as genomic researchers, what is our responsibility in communicating genetic risks to the public and also to public to policymakers? What is our responsibility here?
I think we have to be like really transparent about what we can actually infer from the results, like who has been included in the development of the identification of the genetic risk factors, and who has it been validated in to know that it is really something that will be generalizable across populations. And if there's a chance that some findings could exacerbate health disparities because it's not applicable across populations, or it's it doesn't work well in certain populations, that's something that we need to be really forthcoming with and open about to make sure that we don't exacerbate health disparities.
Okay. Right. Thank you very much. We are most grateful. And let's focus our attention now on future directions. What are the emerging trends when it comes to genetic epidemiology, and how does that excite you?
One thing, like a newer technology that is becoming more popular right now is there's some platforms that will integrate higher coverage whole exome sequencing with low coverage whole genome sequencing. And it's really affordable, like much more affordable than doing just whole exome sequencing with high coverage on its own. At certain places, at least, it's really affordable. And I think that's a very exciting new technology, because if it's something that because it's so affordable, it's something that I think could be implemented at scale and be more accessible to researchers and different places that might not have the means to pay for the really expensive whole genome or whole exome sequencing data. But these new platforms that are really affordable, I think will really kind of change what we're able to do in genetic epidemiology, because it's so affordable. I think we'll be able to get a lot more data in a lot more people at some point. And it's still really good data that is pretty comprehensive of the most things that we might want to do research with. So that's one technology that I'm really excited about, that I think will be really impactful moving forward in our field.
Yeah. Okay. So how do you envisage the future for genomic research, population genomic research, in addressing global health challenges? What is in the future?
Yeah. I mean, it's really hard to know what it will look like in the future, but I do think there's really good chance that a lot of the findings that we're having, especially with polygenic risk scores, it's a pretty popular thing right now that these could be something that are implemented more broadly across different health systems and used to help make decisions about screening and other preventive strategies. So I think that is a really exciting thing that could be a good way of addressing some health challenges.
Okay. But what's your opinion about international collaborations when it comes to genomic research?
Yeah, I think they are really crucial to really trying to advance equitable research, to make sure that you have those collaborations. And again, I think the MadCap example of building those collaborations in a way that is really collaborative, like really collaborative, not just on paper, but really having them be involved in the research from all aspects of it, like generating the data and being involved in all the publications and giving them ownership over that data. That's another thing that I really like, the idea of like giving not just researchers, but also giving communities some ownership of data that's generated in that community. If the community could really benefit from it in a kind of ownership sort of way, I think that could be a really nice thing as well.
Okay, that's a great one. So what motivates you in this field? I think that's very, very important. What keeps you going?
Yeah.
When you wake up in the morning and you have to leave your kids and go to work and go and do genomic research, what motivates you?
Yeah, most broadly, it's just the chance. I feel like there's such a good chance of this type of research being able to help us understand what causes disease. And if we understand what causes disease, potentially being able to prevent disease from happening and letting people live healthier lives and avoiding downstream complications that they have from developing a disease. Those are the things that really keep me going. And, with prostate cancer in particular, we have really good genetic risk factors we identified that I think could be very impactful for screening decisions. So thinking about what are the next steps that we need to do to really move this into a clinic, those are some of the things I think about a lot that motivate me.
Okay. So having been in this field for some time, the challenges that comes with it, the opportunities that comes with it, what would be your advice or your message to young and upcoming women scientists or early career researchers who will be interested in venturing into genomic research, in venturing into epidemiology research?
Yeah, I would say, one of the most important things about research is really finding that topic that you feel passionate about. Because if you're passionate about it, it's not so much a job as a passion. It's something that you love to do. You spend your time doing it because you're really passionate about trying to solve the problem that you're working on. And then, to kind of nurture that passion and your skill set, surrounding yourself with mentors and collaborators who share that passion and are good supporters, I think is a good way to kind of build your career from the start all the way through, probably.
Okay. So like I mentioned earlier, like you started and like most of us are coming up, it's usually very challenging and difficult to be able to fine-tune yourself and find your feet in a particular discipline and a particular field that this is where I want to be and this is where I want to advance science and knowledge. Casting back or looking back to where you started from and where you are today, what are some of the things that or some of the advice, what are some of the advice that you can give to early career researchers like myself that we should watch out for? Okay, so what are some of the things that maybe we should not venture into, we should not do, or we should do that will help us shape us into finding the right, if we like, field to find to get ourselves into working?
Yeah. I think it takes a lot of exploring to figure out what that right fit is. I wish I knew what it was for me sooner, but I don't think I would be where I am today, and I don't think I would have figured it out if I didn't kind of struggle through it for a while to explore all these different potential options and realize that they weren't good fits for me, and kind of go back to the drawing board to keep thinking about what else might be a good fit for me. Having like the mentors around me that I had to give me those opportunities to explore new things, and not only to explore different research questions. One my mentor that I had during that job I had after my undergraduate studies, she let me take time to go do job shadowing for things that were totally irrelevant, like job shadowing at a high school teacher, job shadowing a speech and language pathologist. Like I tried a lot of different things, and they didn't end up being the ideal fit for me, but I wouldn't have known if I didn't try. So I just kind of had to do a lot of exploratory things and sort of put myself out there and really explore what resources are available for people to do something like job shadowing, because I had to like really formally do that for some of these things. And then kind of be honest with myself about what do I like about this and what don't I like about it. And would I actually enjoy living my life having this career? Um, and I think for me, like I like research because it feels like it's an opportunity to do good for the world. And there's a lot of jobs where you might not have that same opportunity. So I really enjoy what I do, and I feel really lucky that I found it because it took a lot of trial and error to figure it out. But I would say keep trying and give yourself those chances, and surround yourself with people who also help you find those opportunities and are very, have that flexibility to be able to do that.
Okay, so on that note, we are most grateful um, for this wonderful time of yours, for coming to share with us, inspiring us about your journey, giving us insight into, and I mean, we have really learned a lot as a early career researcher myself. I think it's been a very inspirational moment, and self retrospection is very, very important. So I need to really reassess myself again. And like I said, it's really, really difficult. When I sit down and I look at it, like, so every day I keep on trying to learn something new, but I'm sure one day I'll settle down like you've been able to settle down. So we are most grateful for your dedication to science, to leadership, to mentorship, which is truly motivating. And we are confident that your story will encourage many young women and scientists across Africa and beyond to pursue their dreams with confidence and also with purpose. So on behalf of PAPERI, we sincerely thank you for taking your time out of your busy schedule today on this special day of International Women's Day to celebrate with us and with other women in Africa and across the globe. And before we close, we would like to share a final message with our audience.
Final message, I say, find your passion and follow that passion if you find it. Follow it as much as you can so that you can live your life the way that you want to, and spending your time, 8 hours a day doing the thing that you love is really a gift.
So thank you very much, Dr. Burcu Darst, for those wonderful inspirational words. And to our audience, we thank you very much for joining us today to celebrate the International Women's Day. International Women's Day. We are most grateful, and we encourage you all to continue to patronize and to follow PAPERI's program so that together we can advance science, we can advance genetic genomics and scientific leadership across Africa. Please remain connected with us on all our platforms, on WhatsApp, on Facebook, on LinkedIn, on YouTube, and everywhere. And as we continue on our Bright Minds series, we are most grateful and thank everyone once again for this wonderful opportunity, and happy International Women's Day to all our dear sisters and mothers. Thank you very much, and see you some other time. Thank you.
Thank you so much.